1 week after President Trump declared the opioid epidemic a national public health emergency, his commission, led by New Jersey Governor Chris Christie, released their recommendations on how to best combat the crisis. Alex Miller's been going through that today. You've been looking into this report. They have dozens of recommendations you found, but one thing you thought was glaring that's missing.
It was glaring. They put out 53 recommendations, everything from how doctors are supposed to handle this to the courts to research, but they left out exactly how much it's all going to cost.
91 Americans die every day from opioid overdoses. That's according to the Center for Disease Control. It was one of the many topics tackled on the campaign trail, and one President Trump has made a point to discuss. Within months of taking office, he tasked an opioid commission to figure out a comprehensive way to attack the epidemic. Today, we got their recommendations. It focused on 4 main topics. First, treatment. They want more emergency responders to have access to the overdose-reversing drug naloxone. Some states prohibit certain responders from administering it. They want to do away with that. The commission also wants to increase access to both treatment and recovery programs, as well as medication-assisted therapies. Second, the commission put a big emphasis on doctors. Much of the crisis began in a doctor's office. Many opioid abusers started by using prescription medication for an injury or after surgery. The commission suggests significant funding be allocated to train doctors on pain management. They want the DEA to require prescribers to take part in an education program before renewing their license. Additionally, they're requesting patient questions about pain to be eliminated, so providers don't prescribe opioids just to appease their patients. Third, the expansion of drug courts to every federal judicial district. The commission states less than a third of federal districts and less than half of U.S. counties have drug courts. This alternative has been shown to reduce recidivism and engage people in treatment. And finally, a drug campaign. The president spoke about this plan in his speech last week. The White House is planning a far-reaching, multi-platform media campaign to focus on prevention. The one thing the commission didn't ask for? Money. The commission did not request any new federal funding, despite citing the lack of funding as one of the biggest barriers to fixing the issue.
So it is really going to be up to the Congress if they want to put these things into effect, because as we know, everything costs money, and if you want to do anything, you're going to need Congress's approval because they hold the purse strings.
And Congress has said we're waiting for the president. The president has said he's going to put it forward. We're waiting to see how much he wants.
It's just such a cycle.
Alex, thank you.